Includes review, prep, test taking strategy, and of course, commonly tested topics you need to know for your NCLEX. Let's get to it straightforward, right? A nurse has attended staff education program about heat stroke and exhaustion, which finding the nurse should expect when evaluating a client with heat stroke and exhaustion. So this is always confusing, okay? There's exhaustion, right? And then there's stroke. Both of them, you are exposed to heat. The main difference between stroke, if they ask you for stroke, look for neurological problem. So neurological symptoms and temperature greater than 104. And then they know when you start getting into the stroke, initially when you have exhaustion, you have a lot of sweat. You sweat and you lose all your fluid, all water, you get dehydrated. You get to the point there's no water to be lost anymore. So your skin is dry, right? It's hot. Those are the three things you should know about stroke. Neurological symptoms, temperature is greater than 104, and your skin is dry and hot. Therefore, which one you should select? They are not sweating anymore. They don't have GI symptoms anymore. They passed that stage. Skin is going to be hot and dry. Temperature is too low. It should be like greater than 104. And neurological symptoms, lethargic and confusion. Test taking strategy. You see, I break down the question. I know what I need. When I'm coming for the answers, it's a cheap shot. Do that and try it and see if it doesn't work for you. Same thing. I'll break down the question and then answer the question. Which action by the nurse is a priority? I'm looking for a priority. And it's provide care for a client with what? Rhabdomyolysis. I know some muscle is dying, right? That's all, dying muscle due to cocaine use. So if this is the muscle, probably injected cocaine. Now the muscle is dying. How do I know? I see dark urine and muscle pain, and that is rhabdomyolysis. The most important thing is the muscle protein is going to be released. All the chemicals in the protein will be released. The sodium, potassium, everything, phosphorus, everything will be released. But what is the problem? You don't want this protein to go to the kidney and cause problem. All these electrolytes being released, you have to dilute it first. Dilute everything up so that you can get rid of those chemicals and it does not affect the patient. Of course, I'm going to repeat creatine kinase to see how much muscle is being destroyed. Obtain EKG. Yeah, I'm going to get an EKG to make sure there's no electrolyte abnormality. But the prioritized information is to dilute the fluid. So give them a solution. Of course, I'm going to check BMP. But what is your priority? Give them fluid. So number 3 is your right answer. This is a test taking strategy and prioritization. So if you have to choose one, choose hydration. And let's provide care for several clients on the maternity ward. Which client need antibiotic for group B streptococcus, right? GBS, group B strep, right? This is usually tested at 35 to 37 weeks. It's a normal flora in the vagina. In the vagina, it does not cause any problem, but if the kid get exposed, it's a problem. There's some situations where you have to give it prophylactically, right? And some situation you just have to give it to you because you know the patient has infection. Prophylactic means they don't have infection, but you're giving it preemptively, right? Example is 36 weeks is preterm. So anybody in preterm labor, you know the baby is not that developed. Therefore, you better give them group B strep because it can be a problem. If the kid get exposed, it's a problem. So this patient get antibiotic. 37-week is normal term baby, but there is a premature rupture of the memory. The memory, we have a prolonged rupture of memory. The memory is being ruptured. It's taking a long time. Therefore, we should give it to them. 37-week gestation, they already had a previous GBS baby. We should not take a chance. 35 weeks preterm, but they are not in labor. But 35 weeks, this is the time we test it, and you have positive, we're going to give it to you. 36 weeks, this is the time we test it. You negative, we don't going to give it to you. So 1 to 4 are your right answer. 1 to 4. And then provide care for a client with preeclampsia receiving magnesium infusion, which action by the nurse is a priority. Test taking strategy, go for the basket. Preeclampsia and magnesium. Ask yourself, why is this patient who is as preeclampsia is receiving magnesium? That means the main idea is to prevent seizure. So if you have to do anything, picking an answer, anything that is helping with seizures is good. Keep the light down. Yeah, you don't want to overstimulate them. It's good. Keep all four bed rails up and padded. That is seizure for safety. Have the bedside commode so that they don't get up. That's also good. Keep them on SEPs. You should not keep them on SEPs. They should be MPO. But laying down, keeping the light down, and having a commode is no more important than preventing seizure, which is number two. So that's your right answer. Okay, so that's your priority. And it's provided care for a client with nausea, prescribe Ondansetron, right? Which action by the nurse is a priority after medication administration. Same thing. You have nausea, I give you Ondansetron. Which one is a priority? These are the three. Connect the dot. Nausea or Ondansetron. Why? What would I want to do? After you give a patient nausea medication, what is your priority? You got to be sharp. You know, Down syndrome, one side effect is QT prolongation, right? It also has extrapyramidal side effects. So those are the things I'm looking for, and I'm being sharp about it, right? Cardiac monitoring sound like QT prolongation. You're going to get drowsy anyway, but you don't have signs and symptoms of EPS. You get muscle cramps and you get pink fluid sputum. I put this there to just distract you. Pink fluid sputum, it does not cause lung problem. It does not cause pulmonary edema. It can cause tardive dyskinesia. I don't see that by cardiac monitoring is one because of QT prolongation. But people who choose this because it's worrisome, but that is a trap. It's designed to trap you. So one is your right answer. Number six, NS has attended staff education program on irritable bowel syndrome, which statement by the nurse indicate correct understanding of the program. So to answer this question, you have to know what is that? IBS. The key thing about IBS is sound like inflammatory bowel disease. No, it's just you have constipation and diarrhea. There is no blood at all. And the treatment is to give you anticholinergic to slow down your bowel. We think the bowel is overreactive, and therefore you have constipation sometimes, then you have diarrhea. So anticholinergic, no cholinergic. There is no recurrent bowel obstruction. There's no bloody bowel is constipation alternating with diarrhea. Number seven, NS has attended start of the education program on diverticulitis. Which clients the nurse should be concerned about? So which client would the nurse be concerned about? There's certain key features about diverticulitis. Look at it. Itis, infection. What is the problem? You have pain on your left side. That's where the pain is going to be, right? And if you have itis, your white count is going to go up. The location is left lower quadrant. Itis, you're going to have fever. Others is gone. If you don't know number four, you're going to pick it because you have eliminated. The white count does not matter. When somebody has inflammation, you should never put colonoscopy or sigmoidoscopy through the rectum to there. It's going to cause perforation. And therefore, number four is the right answer. NS is reviewing phone calls from several clients on levothyroxine. Which client need the first phone call? This is to figure out if you understand the medication. It's a common medication you have to know. They ask all the time. I've given you key facts about this medication. The patient take the medication, the client take the medication on empty stomach. That's good. This guy take antacid, but he take it 6 hours after taking the medication. That's good. The guy has gained 5 pounds, right? This is levothyroxine. It's the thyroid hormone. You're supposed to lose weight. If you're gaining weight, the medication is not working. This patient, I'm worried about it. The client remained upright for 30 minutes after taking the medication. So that's good. Therefore, who do you see? Who require phone call? Number three, the medication is not working. He still has signs and symptoms of hypothyroidism. So that's the patient I will see. Number 9, a nurse is in emergency department is suspecting 4 clients. Which client the nurse should prioritize for a private room? Who need to be in the private room? That means who is still infectious. 2 weeks old, varicella infection, cluster lesion. You good. You are not infectious anymore. Slap check rash. As soon as I see slap check, you are not infectious. It's probably B virus 19. It's dangerous without the rash. Well, as soon as you see the rash, it's no more a problem. Usually it's droplet, but as soon as you see the rash, it's no more droplet. Latent TB is just PPD positive. Scabies with the boros is contact precaution. That's that one. It's very infectious. Need to be in isolation. NS has attended staff education program on cystic fibrosis, which finding the nurse know is consistent with the clinical condition. Select or apply. What is cystic fibrosis? Recurrent lung infection. They look like bronchitis. They don't look like emphysema. Therefore, pulse sleep is not indicated in the cystic fibrosis. They don't have barrel chest, that is emphysema. They have large voluminous stool, that is consistent with the GI problem with cystic fibrosis. They have growth retardation because they cannot absorb any nutrient. And the prescription for mucomist is going to break down the mucus. Therefore, 3, 4, 5 are your right answer. Thank you for watching. Adaptive class out.